What is laser therapy? The technology utilizes superluminous and laser diodes to irradiate diseased or traumatized tissue with photons. These particles of energy are selectively absorbed by the cell membrane and intracellular molecules, resulting in the initiation of a cascade of complex physiological reactions, leading to the restoration of normal cell structure and function. The process is curative and therefore results in the elimination of symptoms including pain. In addition, it enhances the body's immune system response and facilitates natural healing. The therapy is completely safe and has no adverse effects. The technology is highly effective in the treatment of musculoskeletal conditions, arthritis, sports injuries, wound healing, and a wide range of dermatological conditions.
An 88-year-old man who 70 years ago, had a fracture that ran through his thigh bone and shin bone. He was in the war at the time and in Italy, and at that time they did a makeshift job of trying to reset the fracture in his leg. Since then, he's had 70 years of chronic pain in his leg. He has a contracture in the back of his knee that doesn't allow him to straighten his leg completely. He walks with a cane, and he lives every day in chronic pain. He was a guy in the area, had heard a little bit about the laser therapy, and decided, why not? I'm 88 years old, I've got a lot of good years left ahead of me, I'm going to give it a try. He came in, he's now had about 10 or 11 treatments. His leg can straighten out completely. He no longer needs his cane to walk, and he's living in about 75% reduced pain than anything he had before. And again, this is after 70 years of having pain in his knee.
How long does a treatment take? Treatments can last between 15 minutes to over 1 hour, depending on the condition and area being treated.
Laser therapy is a very important part of chronic pain management. Chronic pain in the past has had only surgical interventions, which are often permanently damaging to the individual. That is, to get rid of pain surgically, you often have to remove something or cut something permanently, or inject some sort of material into the area, hoping that the cure will be permanent, but often it's not. Or you have painkillers like morphine and OxyContin and oxycodone and all sorts of pills by mouth that assist in the management of the pain. So in the past, that's all we've had. Laser, and more specifically phototherapy or photomodulation therapy, is probably the single most important therapy that is available to patients with chronic pain, because patients with chronic pain can either be improved and or cured using phototherapy or photomodulation therapy.
What are the clinical benefits of laser therapy? Highly effective for many disease conditions. Cures the pathology, therefore pain and other symptoms disappear. Reduces the need for pharmaceuticals and frequently surgical intervention. Easily applied. Restores normal range of motion and physical function. Non-invasive. Non-toxic. No known adverse effects. No drug interactions except photosensitizers. Often makes surgical intervention unnecessary. Often provides a treatment alternative for patients that have not responded to conventional therapies. This latter is extremely important.
Well, the first and very important element interacting with patients is patients' education. And during our first session, this is when we thoroughly examine our patients. This is when we establish the diagnosis. We tell in kind of brief version as much as we can about the laser therapy or photostimulation. And I usually use this analogy because everyone is familiar these days with photosynthesis. When green plants, trees, they absorb the energy of the sunshine. And this is the energy that will be transforming those plants. And this is the energy that will be promoting regeneration and growth, etc. So the human body has the ability to absorb the light and respond to that stimulation. We do have not the chlorophyll, but it's called cytochrome C, and every cell would have this ATP production taking place, and this is what will be boosting the healing properties of the body. So technically, by simplifying this complex science and delivering this message and explaining out to our patients what exactly laser therapy will be doing, how this photo energy will be transforming into biochemical energy, it helps to understand and receive and accept this therapy. And it is a very important therapeutic factor, patients' education, so that healthcare practitioners and patients would be on the same page.
How many treatments are needed? The number of treatments will vary with regard to the individual problem, as every patient and condition responds to laser therapy uniquely. This may be related to the individual genetic makeup. Patients will often feel a positive response in the first 3 to 4 treatments. In a recent clinical report on over 1,000 patients treated with the BioFlex Professional Laser Therapy System, patients averaged slightly less than 10 treatments to resolve their condition. In some patients, 1 treatment is sufficient. However, on average, 3 to 25 treatments are required. In some cases, additional maintenance treatments may be recommended.
Laser therapy is an integral part of my practice now. There's almost nothing I do in family medicine that cannot be treated with laser therapy. Of course, I have to stick to the protocols and the what we call the standard of care, if you will, in treating different conditions in family medicine. But every year, there's more and more family medicine of what I do that is going to impact how I treat conditions that used to be treated only with medication or surgical intervention. Us allopaths are famous for if you can't throw a pill at it or cut it on it, it's not worth doing. Now I have a modality of healing that I can avoid medications in certain instances that actually cause harm to other systems when you're trying to shoot at the one you're trying to heal. Surgical intervention in certain areas are fraught with peril, especially spine surgeries. And even where surgical application is important, such as replacing knee and hip joints, we can speed through that transitional healing phase dramatically fast. That if we can pre-treat as well as post-treat these surgical patients, we can avoid a lot of chronic pain scenarios that result from slow healing. So the power of the laser is, I predict, going to be within 20 years, it will be in all pre-surgical suites and all post-operative recovery rooms. All these sites will be treated before and after surgery, and you'll see the complications of infections drop dramatically. You'll see the healing times drop dramatically. The rehab times in rehab facilities after knee and hip replacements drop dramatically. So we're on the cusp of a huge breakthrough in the medical world.
Conditions treated. Most frequently treated conditions: back problems, soft tissue and sports injuries, arthritis, joints, knees particularly, repetitive stress injuries, neck, shoulders and arm syndrome, computer-related. Back problems: degenerative osteoarthritis, spinal stenosis, sciatica, disc herniation, degenerative disc disease, myofasciitis. Soft tissue and sports injuries: ligament, tendon, muscle tears, knee dysfunction, meniscal ligamentous tears, fractures. Inflammatory conditions, tendinitis, supraspinatus, Achilles, etc., plantar fasciitis, rheumatoid arthritis, repetitive stress injuries, carpal tunnel syndrome, rotator cuff injuries, epicondylitis. Neurological conditions, neuropathies, reflex sympathetic dystrophy, multiple sclerosis, concussion, dementia, experimental. Dermatological conditions, eczema dermatitis, psoriasis, herpes, post-herpetic neuralgia, burns, acne. Wounds and dermal ulcers secondary to compression trauma, atherosclerosis, diabetes, venous stasis, lymphedema. Temporomandibular joint dysfunction, gout, fibromyalgia.
When we first started early on, a lady, I think she's in her 50s, but hurt her shoulder quite early on when she was in her 20s, and had a frozen shoulder for several years. And just after 3 or 4 treatments, she had almost a full range of motion. Her pain level went from probably an 8 down to a 2 or a 3. So we had quite a dramatic improvement with her just within a few treatments.
Some physiological effects. Increased production and release of endorphins, natural analgesics. Cortisol, precursor of cortisone. Growth hormone, instrumental in tissue repair. ATP improves and regulates cellular metabolism. In addition, there is increased protein synthesis, collagen, DNA, fibroblasts. Venous and lymphatic flow facilitated. Increased angiogenesis, new arterial and capillary formation with elevation of oxygen saturation. Enhanced immune response, etc. These are just some of the many processes that accelerate cellular regeneration, cartilage, epithelium, and restore normal cell morphology and function.
In the first part of any process of healing, there's the inflammatory stage of healing. And in the past, we used to leave people in casts. We used to leave them in their sling. I wouldn't see them for 4 to 6 weeks after. I can start way earlier, day 1, day 2, with fractures. And they make a remarkable improvement. Pain relief, less medication, and then an accelerated, very accelerated process to return to activity. I work a lot with athletes, and their return to activity is way quicker, way quicker. One case history where I treated the person twice a day, and I treated them before they wanted the swelling to come down so they could get a cast on. Well, when I saw them for 5 days and it was time to get the cast on, I said, no, we're just going to put you in a boot now. So then I was still able to treat her while she had the supportive boot on, but she was not on crutches. She had this undisplaced fracture in her 5th metatarsal. And what you would usually take 4 to 6 weeks, I had her back playing baseball as a catcher in 24 days.
Is laser therapy covered by public or private insurance plans? Insurance coverage for laser therapy varies depending on the professional designation and/or qualifications of the therapist and the insurance plan.
I think for me, the ones that stand out, for some reason, maybe we've just had a few of those patients that were in so much discomfort from their osteoporosis, that those are the ones that come to mind. But I can remember quite a few patients, coincidentally all females, who suffered from significant osteoporotic pain, and the usual medical management did not relieve the symptoms, specifically the pain control, as much as we had hoped. And I knew that it was used, laser was used for that, and decided, you know, what the heck, let's give it a shot. And without exception, really without exception, each and every one of those females that we have treated for the pain control and osteoporosis had very, very good results. So that would probably be the one that stands out in my mind the most.
The BioFlex Advantage. Clinical experience. Over 20 years of development and clinical utilization. Often dramatic results. BioFlex systems are operative in 48 countries worldwide and have been termed the gold standard in the industry. The company conducts extensive clinical research with the objective of expanding the scope of application, particularly in conditions where current medical approaches are ineffective.
Laser has certainly broadened what I see in my office. It's really enhanced my practice, it's grown my practice, and that was the idea for bringing it into my office. I'm seeing a lot more sports injuries. It's increased the demographic of my practice. I'm seeing a lot more elderly patients with degenerative conditions that I can help with their pain. I can see and help a lot more people now. I can't just switch all my chiropractic patients over to laser patients. I had to expand my practice with laser, and any field practitioner can do what I did.
Is laser therapy safe? Hundreds of double-blind research studies have shown laser therapy to be safe and effective. Laser therapy is non-invasive, non-toxic, and non-thermal. Unlike other forms of radiation, laser therapy is beneficial rather than harmful to tissue.
A 64-year-old man fell off a tree and broke his humerus, and 4 days later he came to our office. Through the advice of his wife, we're treating her actually for shingles very successfully, and by then he was riddled in pain. His arm is double the width because of the swelling. He has hematoma running down right through, you know, front and back of his chest wall, and we start lasering him. At the time, he was already told through emergency that he would need to be pinned, but he has to wait for an appointment. So we decided, well, we can do something about that. We treated him 4 days. By Tuesday, the following week, he had an appointment with the orthopedic surgeon. He went, and the surgeon explained that, well, we knew we need to do something about your fracture, but I would like to do a second x-ray. And they did, and the surgeon came back with the x-ray. He said, well, I don't know what the heck you're doing. Continue with it, you don't need surgery. What happened was, with the laser treatment, his formation of bone cells are already growing. So we continued treating him. Within a month, he had full range of movement, fracture completely healed, and that's the time he has to go back to the orthopedic surgeon to get a rechecked, and he just say, you're done. And he couldn't believe it. And this is not a 21-year-old. They were talking a 60-odd-year-old man.
I once treated a patient who had back pain, a man in his early 70s. He came with his wife for treatment. And I did the usual treatment. It wasn't a terribly long treatment. And he left and was to come back the next week. And he did. He came back the next week and he said to me, I don't want you to touch me. I don't want any more treatment. And I thought, oh gosh, I've really done something shocking. And he said, as soon as I walked out of your surgery and went to the car park, the tinnitus that I had for 15 years disappeared, and it stayed away. And I don't want to do anything to upset it. So I think that speaks to the quite significant systemic and much more subtle changes that are taking place, rather than just simple pain relieving.
Are there any contraindications? Laser therapy should be avoided in the following instances. over the womb for females in the first trimester of pregnancy. Who uses BioFlex laser therapy? BioFlex laser therapy is being used by an increasing number of physicians, physiotherapists, chiropractors, massage therapists, veterinarians, naturopaths, and dentists on a global basis. Most concentrated utilization currently in North America, Middle East, and Europe. The BioFlex laser therapy systems are currently being used by a number of sports professionals. The Toronto Raptors, the Toronto Maple Leafs, the Toronto Blue Jays, the Miami Heat, and the Canadian National Ballet Company, along with many other high-performance organizations who have utilized the technology as the basic treatment platform for their athletic injuries. This varies with change in head trainers.
I'm Terry Bradshaw. Throughout my career, I have found that a person's success is more often than not dictated by their own self-awareness. Join me as we explore what makes people tick in order to gain some insights. Ruth Muxworthy is once again an active retiree. At one time, she was losing her ability to engage in everyday functions due to severe pain in her hips, hands, and cervical and lumbar spine. After years of extensive drug therapy and searching for a solution, she discovered low-intensity laser therapy. The therapy acts as an analgesic, has a powerful anti-inflammatory effect, stimulates the immune system, and regenerates new, healthy cells. Experts say it eliminates pain and other symptoms.
My husband brought me an article that Dr. Gifford Jones had written, and I kept it for several months and finally decided to call Meditech and made the appointment, and I've never looked back.
Muxworthy received the laser therapy at the Meditech Rehabilitation Center in Toronto. Dr. Fred Kahn founded the company and is the developer of the laser technology and the BioFlex therapy systems.
Our laser systems differ from others by virtue of their sophisticated architectural design. This includes proper geometric spacing of the diodes, flexibility of the treatment arrays to adapt to the anatomical configurations of the areas being treated, and the accuracy and control of the photon stream used to irradiate diseased tissues.
Laser therapy is used to treat a wide spectrum of conditions that may be chronic or acute, degenerative or traumatic in origin. It is particularly useful in treating severe sports injuries, low back problems, traumatic injuries, and degenerative conditions of the knees.
When I first arrived at Meditech, I was suffering from severe neck pain 24 hours a day, and what they found was that there was a lot of inflammation where the nerve was coming out. So with the application of the therapy, able to remove the inflammation, thereby reduce the pain dramatically. So after about 10 treatments, I feel great.
When I came in to Meditech, I had a lot of pain on the right side of my neck, and there was really no position it felt comfortable in. I couldn't sleep at night. And then they treated me with their BioFlex system, and after about a week, all the pain was gone, my range of motion started to come back, and more importantly for me, I was able to start competing again at a high level with respect to my golf game.
At its 2 locations in Toronto, Meditech treats up to 800 patients each week. The BioFlex series of lasers includes a professional system, a more mobile therapist system, and 2 units designed for home use.
A typical laser treatment consists of 3 steps. The first one will be visible red light, the second one will be invisible infrared light, and this is when we use large surface array treatment heads. And the third step of the treatment will be the application of laser probe. This is when we use it manually. So right now you will see a visible bright red light coming out from 180 superluminous diodes.
An increasing number of physicians, physiotherapists, chiropractors, massage therapists, veterinarians, naturopaths, and dentists worldwide are using BioFlex laser therapy.
I use the BioFlex laser system in my practice to help speed up the healing of soft tissue injuries and degenerative osteoarthritis. Meditech does a fantastic job at providing ongoing education to their customers, whether it be through advanced training seminars or providing clinical pearls for those hard-to-treat cases.
Dr. Kahn says over 1 million BioFlex laser treatments have been administered to patients, all without any significant adverse effects.
The change is dramatic. I have my life back. I'm able to walk easily. I'm able to play the piano. I'm able to do normal activities. I'm no longer taking a handful of pills and injections of methotrexate for arthritis. It's just wonderful.
And thanks for watching, folks. And please join us next time on Insight.